Sir, I understand that you're here today to talk to us about your experience in the military. What exactly drew you to the military?
Was my son. He enlisted in 2002, shortly after 9/11, and served 4 years with 101st Airborne, had 2 tours to Iraq, was injured the last tour. He's doing well now, but his involvement with the military got me thinking about how can I also serve. And when I heard that they were short of orthopedic surgeons, that there was a critical need, and because of that there was an age waiver, I volunteered.
Am I correct in understanding that you came in as a lieutenant colonel?
I did, yes.
Okay.
And I can thank the Army for that. They gave me 21 years of credit for my civilian work as an orthopedic trauma surgeon and professor at the State University of New York at Buffalo.
Prior to coming into the military, what has been your experience with the military?
Well, again, because my son, I volunteered to go to Landstuhl, where the wounded warriors come from Afghanistan and Iraq before they come back to the States. We serve as sort of Landstuhl scholars. We go in for 2 weeks, we help treat the soldiers, but also do some education with the providers that are in Landstuhl.
Okay. Talk to us about mentorship, because in today's Army, it's huge. It's a very prevalent program for us.
Mentoring is very important. None of us have gotten to where we are today without good mentors. I'm a program director of orthopedic residency program in Buffalo, and I mentor my young residents. I'm also chairman of the Department of Orthopedics at the State University of New York at Buffalo School of Medicine and Biomedical Sciences, and I have 30 orthopedic surgeons, many of which are just out of their residency and fellowships, and it's my job to mentor them, to be their role model, and I hope to be able to do the same while I'm in the Army.
Excellent. Your civilian experience and the many years that you have, can you tell us about what drove you to the medical field?
I have my father to blame for that, I guess. He was a general surgeon. He served in World War II. He was my role model, and at a very young age, I think my younger brother told me I was 15 when I told him I wanted to be a doctor, and have been able to fulfill that wish, and have had a very wonderful career.
Excellent. Can you talk a little bit about the difference between the civilian, what you do in the civilian world, and what you do for the military, or whether or not that's the same?
Similar but different. I'm a orthopedic trauma surgeon, and I will in the civilian world, and I take care of car accidents and falls and gunshot injuries. But the military injury is so much different. We don't have the severity, the high energy blast injuries, just the severity of the injuries are going to be so much worse. I've seen it during my volunteer work in Landstuhl. I'm aware of what I'm getting myself into, but it's nothing that I've in the world. And am assigned to the 865th Cache out of Utica.
Great. I was in Afghanistan from 03 to 04. I ran the Class 8 mission there, and I was attached to the 452nd Cache. Glad to have you.
I'm glad to be here. They call us Landstuhl Scholars. In Landstuhl, they've invited general surgeons and orthopedic surgeons to come over and help take care of our wounded warriors, but also to help teach the physicians that are in Landstuhl. This came about through the American College of Surgeons Committee on Trauma, and they extended it to the Orthopedic Trauma Association. I also was fortunate enough to help out during the earthquake in Haiti The USNS Comfort, the hospital ship that sailed to Haiti shortly after the earthquake, was in really quite desperate need for additional hands, and they went to the Orthopedic Trauma Association again, and 10 of the senior members of that organization volunteered to help out, and we spent a little over 2 weeks on board treating those serious injuries, treating those serious injuries. I, of course, had to go through basic officer leadership course, which is a basic course for all medical personnel. I've been blessed as an orthopedic trauma surgeon. I've done everything I can imagine in my civilian career, and I'm having this wonderful opportunity to extend my career, to give back to my country, to give back to all those who have served before me. And it will be, if I can convince one person to enlist and follow in my footsteps, that would be wonderful. If you're walking around on a painful limb and you can't hardly walk, and then you see somebody with this fancy prosthetic jumping around and running and actually returning to their unit, they say, why not me?
Absolutely. Thank you for everything.
You're welcome. You're welcome. It's my pleasure. Thank you. And I truly appreciate the military's emphasis on physical training. I have worked hard over the past 2 years to bring myself up to standard, and quite frankly am very proud of the fact that I maxed out on my APFT and scored 331 in the extended scale recently.
We always
short of orthopedic surgeons.
Always
yeah.
short, yeah.
That's why I'm in. What I want to say though is that how honored I am to have the opportunity to serve. I'm 64, and most people of my age are looking forward to retirement, to settling down and doing nothing. And I just cannot tell you how much it means to me to be able to serve my country, to take care of our wounded warriors, to be part of this wonderful team that is the Army.